And can you tell us more about how sleep apnea is diagnosed, like more about the sleep study and how it's treated?
Yeah. So the gold standard is still a sleep study. The sleep study can be done differently. So the sleep study can be done in the lab where there is a person watching. So it's called attended sleep study, what we call as polysomnogram. So there's several things we are measuring during the in-lab sleep study. So basically we're using a EEG to measure the brain waves, EKG to measure the heart waves, EOG to measure the eye waves, eye movements, and then because eye movements are important in REM sleep, and then you're also measuring multiple other things: the airflow, which is important, oxygen levels, sometimes carbon dioxide levels, but a lot of times you don't measure that. And then you're looking at the muscle movements and then respiratory effort. So all those things are measured in the lab, which is still the gold standard for most folks. The recent or past 10 to 15 years, we got home sleep studies now, where basically we measure less of the parameters, at least four of them, not typically the EEG, but rest of the stuff. And then that can be done at home in your own bed, which is good. For most part, we can get the information we need so that we can diagnose sleep apnea. And of course, once we diagnose, obviously we talk about treatment, which probably is your next question. So I can, yeah, we can talk about treatment. So the treatment is typically the CPAP is still the gold standard, which is continuous positive airway pressure. So it's basically the way it's working is almost stenting. So opening up that road we talked about, opening up the street, extra lane. The way it works is you're giving pressure through a mask with a tube and a little device which generates pressure. So that's kind of pushing air into the airway and keeping this tissue which is falling in kind of open. So that keeps the oxygen going and carbon dioxide going out. So that will take care of the sleep apnea problem. So that's how it works. There are other treatments. Of course, not a lot of people love CPAP. It's a hate-love relationship. Some people love it, some people hate it. So maybe 50-50. If you kind of really work with them, maybe it goes to the compliance or compliance with the CPAP, and usage goes up to 70%. So the folks who come to my office, they say, I hate it, doc, and then I have to look at for other things. And we are not born with anything on our face, so it's kind of hard to get used to something and sleeping at night. It takes about a lot of people take about 3 months to get acclimatized. So the other alternatives are kind of dentists make a dental device, basically, which kind of pulls the jaw forward. So it's called mandibular advancement device. It actually gives more room. And then surgeons do other stuff, including a UPPP, what we call the uvula is taken off, palatopharyngoplasty. Basically, what they do is kind of shave off some of the tissue so that you have more room. And there are new devices now, like there's a Inspire device, what we call in US, but it's nothing but a hypoglossal nerve stimulator. So the stimulator is kind of put in like a pacer under the skin, and the leads go to the muscle of the tongue. So every time you take a deep breath and sleeping, you're basically contracting that muscle and the tongue muscle, which kind of is pulled forward so that it's giving more room for the airway. I don't know. Yeah, there's few other treatment options, including I don't know if you have heard Ozempic and all these new medications, which are GLP-1 agonists, which help with obesity, but also actually have shown one of the medication has shown significant tirzepatide is shown in studies. It also improves sleep apnea. Most part likely due to decreasing the obese tissue here, but also there could be other ways it may be doing it. So of course we need more research into that.